The conversation we're having today.
Councilmember Evan Glass recently hosted a forum on combating opioid overdose death at the council office building.
We are experiencing an opioid epidemic across the county, across the state, and across the country. And we all have a role to play in keeping our residents and neighbors healthy and safe.
The hour-long discussion featured a panel of public health experts.
When I started in this role just about a year ago, one of the things that really came and slapped me in the face was the increasing rise in opioid overdose, especially fentanyl, especially it was affecting our youth.
What we try to remind folks is even if you don't think you know anyone who uses substances or has addiction struggles, the reality is you probably do, and you just don't realize it.
Local service providers.
We take what is normally a source of shame and guilt and use it to empower people so people can hold their heads up high again and walk in this community as productive members.
And community members with lived experience.
I'm in long-term recovery myself, so I'm deeply passionate because I have my own experience, my own struggles with opioid addiction and recovery. I want to show others that recovery is possible because it is.
Free Narcan and training on how to administer it was also available at the event. The discussion shed light on available resources for those affected by opioid addiction, including information on how to access free, no questions asked Narcan kits at county facilities.
Our Narcan distribution is completely free and anonymous. You don't have to provide any proof of residency, any ID, any insurance cards, nothing. We're seeing more people give Narcan before we arrive, which is a great sign to indicate that our Narcan distribution efforts are working.
The floor was also open for questions and comments from the audience.
We've talked a lot about harm reduction techniques, what to do, the treatment aspect, the recovery aspect. What about prevention before?
Efforts there have focused around education and targeting youth. We've also done resources available for families and how to help parents have the conversation with their kids.
Are there any resources particular to seniors, and what would be the best way to kind of integrate this information into the program that we run?
We focus a lot on the youth, but we are also seeing this increase in folks over 50. And that is an important group that we need to be thinking about, really just trying to get the word out to folks that this is an issue. I think it in a lot of ways has been silent, and we're trying to shine that light on it now.
In Rockville, I'm Mirsha Sahalu.